You know the feeling, that churning, cramping, yeah, that's just plain uncomfortable gut trouble. We've all been there. But here's the thing. While that feeling is super common, what's causing it can be wildly different, and that means the solutions have to be different too. So today, we're going to dive in and explore how modern medicine has built this amazing toolbox to tame our digestion. I mean, you hear about all these things, right? IBD, IBS, gallstones. It can feel like this confusing alphabet soup of conditions. They're all happening in the same neighborhood, your gut, but they act so differently. So, how in the world do you find the right way to treat them? Well, think about it like this. Your entire GI system is like a busy neighborhood. A problem with the security patrol is totally different from, say, the phone lines going down. And that's different from a simple traffic jam blocking a street. Yeah, they all cause chaos for the people who live there, but you're not going to send a security guard to fix a backed up street, right? And that, right there, is what this explainer is all about. We're going to open up the pharmacological toolbox and see how we've developed these incredibly specific tools for each of these super specific problems. This isn't a one-size-fits-all magic pill situation. It's all about precision. All right, first up, let's talk about that security system problem, inflammatory bowel disease, or IBD. This is a wild one. It's what happens when your body's own immune system just gets confused. It starts mistakenly attacking the lining of your own gut. It's basically friendly fire, driven by your own cells, and it leads to this constant, chronic inflammation. Now, within IBD, you've got two main players, Crohn's disease and ulcerative colitis. And the biggest difference between them really just boils down to one thing: location. For ulcerative colitis, the trouble is pretty much contained just to the colon. But with Crohn's, man, that inflammation can pop up literally anywhere along the entire GI tract. So different locations, sure, but the fundamental problem is the same, that rogue immune response. So, okay, how do you fight a war that's happening inside your own body? Well, the strategy is actually pretty logical. It's a two-step plan. First, you got to control the immediate crisis, right? You put out the fire. Then you need a long-term strategy to make sure that fire doesn't start up again. You've got to keep the peace. So let's look at step one, controlling the fire. This is all about getting immediate relief. So when a flare-up hits, you call in the first responders, drugs like corticosteroids and aminosalicylates. They basically rush to the scene and block the chemicals that are fanning the flames of inflammation. The goal? To calm everything down and get the system back into remission. Okay, but once the fire is out, what's next? How do you keep the peace? That brings us to step two. And here, we're not sending in fighters, we're sending in the diplomats. These are immunomodulatory drugs, and they work very differently. They're slow-acting. Their job isn't to charge into a battle. It's to gently dial down that overactive immune system for the long haul, making sure a new war doesn't even have a chance to start. All right, so we've talked about the immune system going rogue. Now let's switch gears to a totally different kind of problem, a communication breakdown. We're talking about irritable bowel syndrome, or IBS. And here, the issue isn't inflammation. It's more like faulty wiring. The signals between your brain and your gut's own powerful nervous system just get all crossed up, and the result is chaos. And this is a really key difference from IBD. With IBS, we honestly don't know the exact root cause, and that changes everything. It means we can't just fix one single problem. Instead, the treatment has to be super personalized, focused completely on managing whatever specific symptoms a person is having. And this is where pharmacology gets really, really cool and specific. So let's say your main problem is diarrhea. That means your gut is just moving way too fast. The solution? A drug that acts like a roadblock for serotonin. And yes, I'm talking about the same serotonin that's famous for its job in the brain. It has a job in the gut too. By blocking the signal at a certain receptor, you're basically telling the gut, hey, hit the brakes, slow down. But what if your problem is the complete opposite? For someone dealing with constipation, the gut is moving too slow. So you use a totally different tool that does the exact reverse. It actually activates a different serotonin receptor, which sends the signal to speed up. It's amazing, right? It's like having a speed control for your digestive system. Okay. So we've covered rogue immunity and we've covered faulty signals. Next up is a category of problem that's much more, well, physical. We're talking about blockages and backups, just stuff getting stuck where it shouldn't be. And a classic example of this is cholelithiasis. You probably know them as gallstones. They're literally these little hardened deposits, usually made of cholesterol, that form inside your gallbladder. The real trouble starts when one of those stones decides to go for a little trip and gets stuck, blocking the ducts that release bile. And that causes some serious pain and inflammation. Now, sure, surgery is an option here, but pharmacology gives us a much more subtle tool. There's a drug called urzodile, and it doesn't just go in and smash the stones. Instead, it changes the entire environment they're living in. It lowers the amount of cholesterol in the bile, which makes the bile a pretty unfriendly place for these cholesterol-based stones, and over time, they just dissolve. It's less like a demolition crew and more like a skilled chemical negotiator. Okay, another really common stuck problem? Hemorrhoids. Now, these aren't little hardened stones. They're actually swollen, dilated veins down in the lower rectum. But the end result feels kind of similar, right? It's a physical thing causing pressure, blockage, and a whole lot of discomfort. And the treatment strategy here is completely different from how we handle gallstones. Instead of dissolving the problem itself, the goal here is all about managing the symptoms. So you've got stool softeners to make things, well, easier, and then you've got topical creams that launch this multi-part attack. You've got ingredients to shrink the tissue, others to reduce swelling, and even a local anesthetic to just numb the pain. It's all about relief. All right, for our last category, let's look at what happens when a key player in the digestive neighborhood, a whole organ, gets overwhelmed and starts to fail. We're talking about pancreatitis, which is inflammation of the pancreas. Now, pancreatitis comes in two very different flavors. There's the acute kind, which is like a sudden temporary fire. The treatment is supportive, IV fluids, pain relief, and usually the pancreas heals itself. But chronic pancreatitis, that's a whole different story. This is a long-term, smoldering inflammation that causes permanent, irreversible damage. And once that damage is done, just supportive care isn't enough. See, when the pancreas is that damaged, it can't make the critical enzymes we need to break down our food. So what's the solution? It's brilliantly simple. If you can't make it, you take it. Patients get supplements that are packed with the exact enzymes their body's missing. It's an incredible fix. You're literally giving someone a replacement part for their digestive assembly line, all in a little pill. So let's step back and bring this all together. We've seen that gut trouble is never, ever just one thing. It can be an issue with your immune system, a problem with communication, a simple plumbing backup, or even organ failure. And for every single one of those distinct problems, medicine has developed a specific, targeted solution. And this really tells the whole story in a nutshell. If you have a rogue immune system, you retrain it. If the signals are faulty, you retune them. If there's a physical blockage, you chemically dissolve it. And if an organ fails, you just supplement what's missing. This isn't just taking a pill. This is beautiful, precision engineering designed for the human body. And all this brings us to a final, pretty mind-blowing thought. This kind of super specific targeted therapy is completely changing the game for how we treat the gut. It proves that we can untangle even the most complex systems inside our own bodies. And it just has to make you wonder, if we can do this for the gut, what part of ourselves are we going to learn how to precisely control next?